Assalamu alaikum. Dr. Hussain Bushkolachi YouTube channel is with you, and today we will discuss diphtheria, which is a very important public health problem, but it is under control after the vaccination and the efforts of the research and the scientists. Diphtheria is almost under control, but still this is not eradicated. The cases are happening in Pakistan. Almost 20 to 24 cases are officially required registered, but they can be more than that. And it is basically a kind of infection which affects the uh, throat as well as it affects the nose and it affects the skin. So it is affecting almost these three areas. And the word diphtheria is a Greek word and which means a pseudo membrane or a pseudo layer in the or on the skin, and it is whitish patchy skin formed as a result of the infection of diphtheria. Carnibacterium diphtheria is the name, and it is gram positive. Let I should share my presentation so that we can and ultimately we will discuss more about the vaccination because in community medicine vaccine technology or the vaccine is important because it is safe, it is low cost, and it is in terms of economical as well as the cost benefit ratio is more. So let us see what is here in the presentation, and I will share with you the first slide. Let us go to the first slide so that you can have at least a kind of the. So this is diphtheria. You can see the mouth is open and a whitish pseudo layer is on the tongue and in the back of the throat near the uvula and other parts of the mouth. And you can see how toxic it is. The girl affected is very serious. So it is a serious disease and it affects uh, a serious disease. I know that one of my professor son suffered from the diphtheria and he was not able even to uh, take the round of the ward and he was worried about that son. I think ultimately that son was recovered and the professor was a little bit relaxed, but still he was worried about this problem. This is the introduction. It is acute infection. All of a sudden, it is occurs. Corynebacterium diphtheria is the name. Three major clinical types: anterior nasal, facial, and laryngeal. Skin, conjunctiva, vulva, and other parts may be affected. Bacilli multiply locally in throat and produce powerful toxins. So toxins, the bacteria remains at the place, but it sends toxins. So let us see serious bacterial disease, nose, throat, and carnibacterium can produce a dangerous toxin. This is the scientist. Diphtheria was isolated and it was, had a different names, but a French physician, Perry Bretti, Bretonio, Perry Bretonio, 1778 and 1862, almost a century ago, who called the disease diphtherides. The origin was from the Greek word of the leather or hide. So let us move further. The major cause of childhood death before vaccination, antitoxin developed in the late 1800s, vaccine introduced in 1920, and now rare in countries with high vaccination rate. So you can see the impact of the vaccine. In Pakistan, in 2011, data is available, and total 22 cases have occurred, but mostly we have a vaccination program, and DPT, and now called penta vaccine, is given to the children under 5 years. 3 doses are recommended. We will discuss more in detail in EPI program. And this is the diphtheria is deadly. Immunization is the safeguard. That was the message. And let us see the, uh, and this also shows that how DPT with different alternative words, sometimes it is DTP and sometimes it is DAP. So these are the different, but in Pakistan, it is now penta vaccine. It covers diphtheria, tetanus, pertussis, and other diseases also. So this is the penta. It covers diphtheria, tetanus, pertussis, hepatitis B, and Haemophilus influenza type B, Hib, call it Hib. Uh, my baby took all 3 doses and now he is strong and healthy. So this is the feeling. The penta vaccine is free for all children. Let us move further and see the EPI. It is started in 1976 with 5 antigens, including diphtheria, pertussis, tetanus, measles, polio, and now it has 12 vaccines. You can count. In 1978, it was reinforced as an expanded program. In 94, national polio immunization. 2000, pentavalent. 2009, pentavalent vaccine was introduced, and then other vaccines, even typhoid conjugated vaccine in 2019 and 2020. TCV in KPK Balochistan was also introduced in 2021. Measles, rubella, MR, IPV1 and TCV in Punjab and Islamabad. Rotavirus in 2016 and pneumococcal vaccine BCV in 2012 and 13. In 2000, hepatitis B vaccine introduced. So this is a brief history, but let us see the schedule. And this shows that how these are given, including the MR, and the month is written, age is written, vaccine is written, dose is written. So almost 6 visits are required for every child to complete it. So nowadays, door-to-door vaccinations are also available. So vaccine consists of TPT 3 doses, zero point 0.5 ml intramuscular. Let us move further. Diphtheria is preventable through vaccination, early treatment, reduced complication, and public health vaccination program are must. So we must think that EPI coverage should be more than 90-95. It is between 60 to 70 that should be upgraded. And these are the last few 6 times. And you can see this is a health facility, beautiful vaccination facilities are available, but the awareness as well as the health education and the force of the health care is towards the acute care, towards the diseases, not to the public health and prevention. That is the reason that polio is not eradicated and all the EPI vaccines are given, but still we are seeing the outbreaks of diseases, including measles, and now HPV vaccine is also introduced, and some other vaccines may come. And nowadays, the injection is replaced with the uh, skin patch technology, which we call MAP micro array adhesive patch or micro array patch, MAP or micro needle patch. MNP. So I think we must go for the penta also to the skin patch technology so that the fear of the injection. So normally we ask that what are the complications and what are the symptoms of. So this slide will give you a complete question. The symptoms are sore throat, swollen glands in the neck, and barking cough, just like animal cough, and racing heart, wheezing and difficulty in breathing, fever and chills. These are the, so this can be ASPI or ASCII, as well as this can be the common or long and short question. So please remember this slide. With this, Dr. Hussein Bashpolachi is thanking you for watching this. This lecture is made for the MBBS, nursing, other courses, as well as the paramedics and MSPH, MPH, and up to MPhil and postgraduate level. This is very common infection, not frequently seen, but this needs a proper attention, and vaccination is one of the effective. So these EPI vaccines are 90% 98% effective. They are safe. Only your attention and your message to the community, to the population in Pakistan will end vaccine preventable diseases, which are almost 70% of all the communicable diseases are hospital visits. Look how much the economy, the healthcare burden will be reduced, while every almost fourth child will be healthy and will not visit for at least for 12 diseases. Thank you very much, Dr. Hussain Bashpolachi YouTube channel is you can log it, Dr. Hussain Bashpolachi 6343. So with this, I am ending this video. Thank you very much for your attention, and let us. So, once again, thank you very much. And diphtheria we have discussed in detail. We will come up with other vaccine preventable diseases also. Thank you very much. Let us end.